Welcome back. Caesarean section, also known as C-section, has increasingly become a popular birth alternative for most women. While some worry over the possibility of something going wrong during the surgery, others feel it is a less painful process of delivery. The rising global rate in Caesarean delivery has been a source of concern to obstetricians worldwide. In spite of remarkable improvement in the safety of anesthesia and surgical techniques, Caesarean section has a higher risk of maternal death when compared with normal vaginal delivery. We have in the studio a medical practitioner of over 32 years experience, Dr. Omadeli Boyo. Welcome, sir, to the show.
Thank you very much.
So good to have you.
Yeah.
Now, I was born with cesarean, and then with those days, like,
Lucky
it
you.
was, yeah, well, I was lucky. You think I was lucky?
Yeah, lucky you.
So tell us, why is cesarean so dreaded? I mean, why is it such, we Africans,
God
like,
forbid.
cesarean, God forbid, I reject it.
I will deliver like people.
Yeah,
with-
I will deliver like.
Why you say she's lucky? Because I had a cesarean section.
Oh, lucky you.
I was very painful.
Lucky,
Why-
your child was lucky. That's what I mean.
So why
Yeah,
is
why?
it such a dreaded procedure?
I think there are now two issues now. Why?
Why? Are you saying lucky?
Yeah, why I say lucky is that most times people that are delivered through a cesarean section could be described as lucky because it could have been otherwise. And both mother and child could have died. That's number one. Number two, when you come out from through cesarean sections, when it's properly done, you are likely to have escaped the trauma of normal delivery. That is, being in labor for like 12 hours, the baby's head is out, people are waiting for the baby to come out. In cesarean section, the baby enjoys. Why? You get the baby out, it's like trekking to Kano and going by air to Kano. Baby just comes out, happy, screaming, once and for all. So it's the mother that says, God forbid. I'm sure the baby will say, thank God for this flight. You understand me? And then it has been proven over and over again because the essence, the most critical thing in delivery is the child's crying early, if I may use that layman's term. Because we're afraid of asphyxia and children not crying, and even when they are alive, there's a tendency that we may have suffered some brain death because they didn't cry on time. In cesarean section, most children born, in fact, research has shown that most children born by cesarean section tend to even be more intelligent because they cry faster, they are taken care of immediately, unlike coming down through the natural path. Good for both mother and child, but at the end of the day, where obstetric care is poor, where nursing care is poor, where we don't have all the necessary things, the vaginal route, the normal route we call it, could be very, very traumatic. So I'm not advocating it for everybody.
Yeah.
I'm simply saying that if you've had cause to have it, then somebody was trying to save you from imminent danger.
All right,
So
can
you're
I
lucky.
ask a question? I mean, for you to have a cesarean section, does it have to be a medical reason, or can you just choose? Because I remember when I was having my first child, I mean, the pain was so much, I was begging, please, I want cesarean, I want cesarean. But, I mean, that's what I get, no, you don't need it. So, I mean, can I just choose to have it?
Yeah, you can choose to have it. In fact, that's why the rate is increasing. Because all over the world, doctors are even finding out now that in order to avoid medical legal problems, they go straight for cesarean sections. And then there are women who just want to have 2 kids. And they don't want to have fetal wastages, I've been pregnant 10 times, I have 3 living children. In other parts of the world, you are pregnant twice, you have 2 children. So the problem starts with miscarriages even at 3 months before we start talking about problems of fetal wastages at birth, when we have stillbirth and things like that. So most people, especially educated people and people that don't want to go through the trauma of pain. But nowadays, where obstetric delivery can be had with minimal pain, with anesthesia and all kinds of things, you can now deliver with minimal pain. You don't need to go through that.
Me, I went through 12 hours of labor.
Sorry.
I first went through 12 hours of labor before the doctor said, it's coming out to the leg. Cesarean section.
Yeah.
Sign paper. This time I was so weak. If they said sign to die, I would have signed to die.
I
That was
just wanted
how
to add,
terrible it was.
Comparing normal birth
Yeah.
to cesarean birth,
Yeah.
how much do women lose blood? Because I'm sure that's what a lot of people are afraid of. They tend to lose a lot of blood during C-sections and all that.
Yeah, blood loss is always dependent on the skills of the birth attendants and the surgeons in cesarean section. Now, if you're having a delivery in a place where people are not very careful and they cannot anticipate certain disorders and certain things, and you, for instance, you tore yourself, or you tore the cervix, no matter what, you're going to even lose blood more than cesarean section. So you could have a normal delivery where you could bleed more than a cesarean section. You could have a very good, especially elective cesarean sections. Ours was emergency because she had gone into labor and decision was made at a critical point. But if a woman comes in now and says, I don't want to go into normal labor, I want to have a cesarean section, and the doctor considers that it's okay, you could get out in 45 minutes. Wow. I mean, the doctor could finish his surgery in 30 minutes.
Because I had a deaf sister of mine that she died. Yeah. And because when they did the surgery, her blood wasn't clotting. Yeah. So we donated blood and, she was just bleeding underneath. So what would you have termed that to? The surgeon, was he like he was at fault or something? Because we gave her about 16 pints of blood and yet we still lost her because she was bleeding. Her blood just refused to clot. I think because that's what a lot of people are afraid of. Yeah.
There are many reasons why she could have bled. And let's put it this way. If she had had a normal delivery too, the blood may not have clotted. Because what we call disseminated intravascular coagulation. And we have issues with women, with anybody who just finds it difficult to clot. Like if you're on even a low dose aspirin or you're on aspirin, aspirin itself can prevent clotting. Okay. And there are many other issues like inherited disorders that could cause that. Yeah. So if that woman had a normal delivery, even a pile, you could bleed to death, even in a pile. So it's always good to look at the thing in its complete perspective and know exactly, especially post-mortem, and find out what really led to it. But one problem should not make us to throw away the baby and the bathwater.
Yes. Before we come to Nima, let's take Lillian's call. Good morning, Lillian. Are you there? Hello? Oh, I'm so sorry. Yes, Nima.
Okay. I had a friend I lost a friend in 2008. She was in labor. She had a medical history of CS or sickle cell. Okay. But then she used to call it CS, that she's not exactly the SS type. And then she went into labor as at the time before she had the crisis. I think she had the crisis before. We took her to the general hospital then, and then she went into labor. What I expected was for them to opt for the C-section, but they didn't do that. They left her for a long time, and then we had to take her to Island Maternity, and then she was just left on the bed till she died. She didn't have the baby. They didn't do the C-section, but we had to pay for an autopsy, and they had to remove the baby at the end of the day. Well, I'm asking now that, when exactly is it perfect? Do the doctors have anything stopping them from carrying out the C-section on the person that they know cannot,
even for sickle cell patients?
Yes.
Oh, there's so many reasons. The first thing is, we are dealing in a society, we are living in a society where people are very superstitious. And they may even come out to tell you straight off, I want to try. Are you getting me? I want to try. And my mother never had a CS, my siblings never had a CS, I want to try. Maybe that's what she did. And you now go on, you tell them, we're not very objective.
What, who did me?
Maybe that's what happened.
No.
So that's why I use the word
but
maybe.
That's not the case.
So we find out that that's it. So at the end of the day, we still come back to the issue of those people are tending to you. Whenever we are trying to make a judgment on anybody, it's always good to get all the facts. You'll be so surprised that financial reasons could be responsible at times. No, I'm just saying that
sometimes,
financial reasons could be responsible sometimes. At times, the time of the day the patient comes in. You could come in at the time of the day and we're looking for blood in the general hospital, and now things are much better. Actually, in the Lagos State General Hospital, we have so many things in place. But you find out that at times getting even consent, to get someone to sign a consent could take the whole night.
Let me take Rabi's call because I don't want to lose this call again. Good morning, Rabi. Are you there?
Yeah, good morning.
Thanks for calling. Go ahead.
Yes, I just want to welcome the guest, Dr. Boyo himself, and everybody there. Good morning. And I think the doctor should emphasize on not really encouraging the CS. I think it's really a very critical situation in Nigeria at the moment, because personally, I lost a wife in that at Abuja Maitama Hospital, if I'm to say, to be more specific. And really, like you said, there's some negligence of some of the sectors not doing the right thing that they're supposed to do. And as a result of that, we keep having mortality rate because of that. And if at all they should put their things in order, I think it's also a right thing to do, just like you said.
Thank you so much, Rabi.
I think the best you can do, they should look at it very well.
All right. Yeah. Thank you. Yeah. Talking about what Rabi just said, the risks of this CS, because it seems as if we still have a lot of people dying from this process. Why is it so hard for Nigeria? Why is it that we don't have the technical abilities or the know-how to perform a proper CS? Because other parts of the world, CS is just like right there.
Can I add to what you just asked? Sorry, can I just add? Also, how can we be educated to know when a doctor is sounding like he knows his job concerning CS? Because that's the major thing. If we don't know whether he knows his job, then we'll fall at the hands of wrong people.
And the third thing, sorry.
Yeah, no problem.
The third thing is, a lot of these doctors, because CSs are expensive, they just say, she needs CS. Because when I had my baby, I found that a lot of women were having CSs, and it was because the doctors were just recommending it, because in those days, it was 1,000 to have a normal childbirth, and it was 9,000 to have a cesarean section. And I see it happening a lot here.
Okay.
Yeah, okay. If I just come in here, the issues are multifaceted. We start with the person, the patient, and the relatives. When we have people who have already made up their mind that this is not my portion in Jesus' name, and they're in the hospital, you're giving the doctor a leeway because you've already come in with the mind that I'm not going to do this CS. And so the doctor is at a loss. How does he convince you? There are some people that arrive from antenatal clinic. You already know that this woman will end up having a cesarean section. You are not managing the information, how to disseminate this information, because once you tell them you will likely have a CS, they are going to another hospital for antenatal. And so you find yourself trying to manage it, PR, doing all kinds of things until the patient comes. And when they come even in labor, I give you an example of some things that there's no other way to deliver the baby, like a transverse lie, where the head is here and the buttocks is here, or oblique. There's no way you're going to, but you can't tell the patient yet. You should tell the patient. But in our environment, where even you want to do a surgery, the woman will call her husband, the husband will call his brothers, the brothers will call the father, they will call the prophet, not pastor now, a special prophet who will come and tell that you are going to have this baby normally. I have a revelation. They should not touch you with knife. All these things keep going on until the patient is almost dead. And by the time you are now doing a CS under an emergency situation, at times 2 a.m. in the morning, you can't blame just the doctor. We are living in an environment where we are superstitious, we are ignorant. So while doctors can be wrong, and the best way to get doctors when they are wrong is by post-mortem and insisting that every person that dies in the hospital should be taken back to the mortuary for a proper post-mortem, and the cause of death must be validated.
Yes.
But we'll not do that again. The same people that are complaining will tell you, I don't want them to put my sister. She has died. If God didn't want her to die, she wouldn't have died. Her time has come. Yes. So at the end of the day, as long as we don't allow post-mortem, because in Europe and America, there's what they call the coroner's inquest. Once you die in the hospital, they must take you back and look at Michael Jackson. They're still talking about cause of death. They must find out cause of death. Until we do that, and people are implicated, and their licenses are seized, people are sanctioned, then we cannot be complaining about doctors.
All right, let's take some quick tweets very quickly because we have to round up now.
Yeah, Francisca says, cesarean section, normal delivery, all good. What matters is your safe delivery during childbirth. Then someone, Fatima says, is it true that when a woman undergoes C-section, she can't have more than 2 children? If not, in the 3rd trial, she's likely to die. We hear that a lot.
No, it's not
I hear
true.
4 times.
It's not true.
I heard twice.
The basic thing is, was it done properly the first time? And the scars. So you can have CS for up to 3-4 times. The only thing is that the first CS, after the first CS, you should at least wait for 2 years to conceive, so that your womb can rest and you not have to have a rupture. Then you can have a second. Now, if you're going to add all these things together, waiting for 2-3 years, and you are going to have 4 children, you're already talking about 12 years. And instead of having children at 30, you're talking about 42. Would you like to have a child at 44, knowing that the 5th will be a CS again? So these are the issues involved. But really, if somebody has 3 kids, and we encourage 4 kids, by the way, by the National Health policy. So if somebody has 3 kids by CS or 4, that should be enough. But if you can go further than 5, that doesn't mean you die. It only means that the more children you have by CS, the more risks you are going through.
All right, let's take a final question from Nima. Yes.
Okay. Is there anything connected between the blood pressure of a patient, a mother in labor, and the C-section?
Oh, wonderful. Yes, there is.
Because that friend of mine died, and what we had at the end of the day was that she died due to labor hypertension. I've not heard of this before.
When women are pregnant, especially in the 3rd trimester, the 1/3 of pregnancy, you could have a rising blood pressure. If this rising blood pressure is uncontrolled and it's now mixed with swollen feet and protein in the urine, what they call a preeclampsia, that's a very dangerous thing. And once the baby, if it's not properly managed, the woman could convulse. the woman could convulse.
Yeah.
Where?
We'll talk about that one later.
Talk about that one later.
But
The woman could convulse. Now that's eclampsia. Now if the child, if it's not properly removed, the child could die. The blood pressure could hit the roof. And
But
the
they
woman
can
could
go on with the
convulse.
C-section.
Yes, it's recommended.
But now the
C-section.
doctors claim that was what stopped them from doing it.
No, let me just say this because time is going
yeah,
on.
we have
There are
to.
just 3 issues at stake here. Anywhere in the world, doctors are warned that we should not allow 3 dangerous circumstances, risk factors to meet themselves. In other words, if this is your first pregnancy and you have twins, and then you have another problem like diabetes, or you have another problem like this hypertension, doctors will start counseling you that you need a CS. And even in Europe, you can't believe it, in Europe, twin pregnancy is a risk. So if you're already having your first pregnancy and you have twins, they begin to suggest a C-section for you. And you know why they do that over there? Like medical legal problems. Somebody wants to go through, you lost a baby, you sue me. So we're all looking for how best to avoid it. So you find that in those countries, CSs are more common, not because they're necessarily mandatory, but to avoid any
complications.
No, any problem with the law.
Okay. All right. Thank you very much, sir. Really appreciate you coming here.
Okay.
We'll have to bring you back because
All right.
obviously any issues that have to do with women, delivery, birth, it's always very hot. Don't forget to watch a repeat broadcast of our show to 11:30 p.m. tonight. And you can also watch previous episodes on YouTube. You can, as always, global statistics report that 3,000 people die daily from road traffic accidents. Please wear a seatbelt. God bless you. See you tomorrow morning.
Right.